Global antimicrobial resistance is now one of the top 10 global health priorities threatening human and planetary health, according to the WHO. Antimicrobial resistance has emerged because of wrong use or misuse of antibiotics in human health, in animal health, and in agricultural settings. We're now at a point where antimicrobial resistance has become a major threat to our ability to treat infectious diseases, and most specifically bacterial infectious diseases, effectively. And this has huge implications for human health, most especially or most urgently. Implications in terms of transplant surgery, in terms of treatment of diabetes, in terms of access to regular, or what we would typically construe as normal surgery, like hip replacement surgery or cesarean section surgery during pregnancy. It also has huge implications for example, treatment of cancer and for the infections that typically do come with use of chemotherapy. And it further has massive implications for our general approach to public health strategies around infectious disease. The challenge here is that this is now a global phenomenon, and it requires a global coordinated response. In order to achieve that, we need as well, and in the first instance, a global understanding of what is the nature of the phenomenon, and then we can develop appropriate national strategies, and then also appropriate sectoral strategies within the health sector, within agriculture, and within animal farming. The challenge here now, I think, is really front and center about governance. And this is why the Dadala Institute for Global Health Research at York University is strongly and profoundly supportive of the Global Strategy Lab and its efforts to address a policy framework that is clearly focused on governance of antimicrobial resistance strategies. The fact that we now have a WHO collaborating center based here at York University is an extremely important opportunity that the Dadala Institute is very, very proud to support. And its focus on governance, and most especially on policy, on practice, and on science, and on the relationship between these three variables, if you will, toward the development of appropriate guidelines and appropriate national and global action plans. This really is central to effectively containing, controlling, mitigating, and developing appropriate strategies for antimicrobial resistance.